All right, welcome to the show. My very good friend, Noah Lang, who is the founder and CEO of Stride Health. Noah, welcome to Health Further.
Thanks for having me, Marcus. It's fun.
Noah, we have had a lot of fun over several seminars, just getting to know each other. And I so respect, first of all, you're an entrepreneur in the healthcare industry. One of the hardest things you can do as an entrepreneur in America, this industry is so upside down. And so, you're not just you're not just working to make things better. You certainly have to have a little bit of a revolutionary streak to try to be an entrepreneur in this system because it's a gauntlet. It's super Byzantine, and the reason why you're on the show today, besides being just cool as hell, is you've hit a real milestone, and we're not going to get to that right away. We're going to talk about this company that you've built, why you've built it, and then we'll talk about this milestone that is not just a milestone for your company, but also a milestone for the future of employer benefits in America. But can we just start by talking about Stride Health, the origin story? Like, how did you decide you wanted to create this company, and then we'll kind of go from there.
Sure. Well, the good news, you said you have to have a little revolutionary streak. Maybe it's a little crazy streak too. I had no idea what I was getting into because this is my first job in healthcare. And I think that played a big role in my willingness to dive headfirst into it. At Stride, what it's become is we're trying to build a benefit system in this country for individuals in a country where the benefit system is built for companies. But it started with the Affordable Care Act. And I got curious post Affordable Care Act about how these people were actually going to go get their coverage. And I just happened to be picking my head up and sticking it into healthcare around the time where healthcare.gov was imploding. And, shout out to the U.S. Digital Service for helping them get over that hurdle and creating a very stable platform. But at the time, not only was the government website not working, but I didn't really think people wanted to go to the government for recommendations and to make decisions about their financial life and their health life. And so the butt of Stride, the initial kind of version of Stride, was we built the recommendation engine, an algorithm and a really elegant user experience to help people who didn't get job-based benefits make a smart investment decision in their health. For me, it was me coming to a personal realization. Like, I just cared about healthcare. I decided I want to spend my career in healthcare, but I'm not clinical. And as I started looking at the spectrum of healthcare consumption and all the broken transactions at a consumer level, which are not news to anyone, it struck me as really odd that no one was really helping to handhold people, especially those who were on their own, through a decision of how am I going to pay for all this, right? Insurance it's a payment mechanism. And secondly, we have this totally new marketplace where anyone can get covered, thank God, regardless of their gender, their illness, or their health. And yet you don't have any revolution, to use your word, of like how people are going to make these decisions. It has existed in other areas of financial decision making, robo-advisors to plan your retirement for higher net worth individuals, right? But not for the everyday American who's going to have to pick their own health coverage, and lucky for them could get government assistance in paying for that coverage. So that was the first bud of Stride. I was like, can we just make this an easy decision and not have it be, Marcus is going to pick this one because the premium looks like it's $30 less than that one.
Right.
But instead, Marcus has got a fair understanding of how much healthcare he's going to consume this year based on his conditions, his prescriptions, a little bit of forecasting based on Marcus's demographic and where he lives and his age, healthier than the average. But figuring out what your personal healthcare forecast is, helping you figure out what you might qualify for in terms of tax credits to lower your premiums, and then baking that all into a really elegant UX. And that was it. We just want to see if we can make that happen, right? Can we help people make a basic, or what should be a basic, financial decision more easily? And our really rich goal is, like, can we make it delightful? Which sounds silly to anybody in healthcare. But that was the butt. That was the first starting point of Stride.
So I think the thing that I love about that is, there are two things. One, as a general investment thesis, I have realized that better matching in every way you can think about it in healthcare is a win. There's so many opportunities to better match individuals with the services, the people, the information that they need. And so much, people talk about care navigation. It's so much deeper than that, right? And so you focusing on something that is so fundamental to our healthcare experience as patients, citizens of the United States as a result of the Affordable Care Act, but not really clinical is wonderful. And I love that you are creating, effectively like a graph picture of me and saying, hey, there's no way you would be able to take all these data points as an individual and then do this search on your own. So how do we then make a much, much better search engine, much better matching system to kind of connect you based on who you are with the best options for you? I just
Yep.
think that that's, and not just boil it down to premium, which is, it doesn't tell you anything. I mean,
No.
it doesn't tell you anything.
And I try to do it myself. I was a relatively healthy person. It's been a decade now too, but I tend to hurt myself a little bit. And I try to figure out, if I want to plan for an MRI each year and I want to plan for some emergencies, like I tried to build my own spreadsheet and I couldn't even get my hands on the data as an individual. And so it just felt like an unfair decision that we're asking people to make entirely on their own, or even with the help of a human who doesn't have a great computer, frankly, doing the math and
Right.
backing it up. And that probably exists throughout healthcare, right? I talk to people every single day who are making an employer benefits decision and can't pick between the three options they have, let alone the 100 options you might have on in the ACA marketplaces. But we stay pretty committed to that individual, to the people who
Mm-hmm.
don't have an employer providing
Right.
a second or tertiary safety net. Even though we've had a lot of knocks on our door to use that same recommendation system for large employers or for large payers. But the kind of the next great realization for us, I thought it was honestly, I thought I was building a healthcare company. And the next place we're marching to was great. You have health insurance. Let's help you use it. We do some of that today, right? Let me pick a doctor. Let me help you figure out what happens if you're in the ER. And we're really found us building a company around a system, right? A healthcare system. And I had this realization, or rather, I got whacked over the head by, I remember one specific time I was sitting in Long Island City, New York, and I spoke speaking to 1,000 Uber drivers, and I probably
Mm.
spoke personally to 40 of them that day. And they very quickly started opening their worlds up to us and said, "This is great. You've made help me make this healthcare decision. How can you help me with these 15 other problems I have?" And I kept hearing that every single day from the people who were showing up and knocking on our door was, I've got a gap here in my life, in my financial livelihood because of the way I work.
Right.
And when you parsed apart all these issues, it was really about we have a benefit system that's stapled to traditional full-time W-2 work. And you've got, today over 60 million Americans who are freelancing in some way, shape, or form. You've got self-employed Americans. I'm the son of a solo practitioner attorney and an independent realtor. Right? My parents, you might not think of them as gig workers, but they had to figure out this stuff on their own when they should just
Sure.
be focusing on their trade. And you have, small businesses who can't kind of take time or effort or have the capital to go and bargain or buy for group benefits for their workers. And so it seemed like there was this moment in time I'll never forget where like we have a choice to make. We're either going to be a company built around healthcare or we're going to be a company built around a type of person.
Mm.
And it turns out it was a very easy decision, but it was pretty fraught one at the time. It was like, we need to build a company that's focused on solving people who don't get job-based benefits, regardless of how they work, to level the playing field because the benefit system we built in this country is about 75 years old. And when we started delivering benefits in this way, the average American had one job for the rest of their life. So it made
Mm-hmm.
sense that their pension was stapled to their job and that their healthcare was stapled to their job. And sometimes their housing was stapled to their job. But we're still living in that world. And that's what gets me up out of bed every day. That's what kind of grinds at me. And like the Affordable Care Act was a great first step in making health benefits no longer dependent on your job. But we still have just about every single benefit either dependent on your job or unfairly kind of set up if you don't have an employer doing the bargaining for you. And that's kind of become our mission now is to level the playing field and give people who work in whatever way they so choose access to the same or better benefits, starting with healthcare as a foundation that you might get in a traditional in quotation marks a full-time job. And I sort of chuckle at that because it's like we talk about the future of work, but like it's the now of work. The world
Yeah,
no longer works
I
this
wanted
way.
to actually go there for a minute because I'm sure you have some more stats. You talked about the 60 million. We all live in a world where, quite frankly, we depend on these gig workers. The easiest place to point to is, your Uber or your Lyft drivers. But I think if we really thought about it, there would be many, many more instances where we just sort of take for granted that the infrastructure of our day-to-day lives are there, and what's underpinning it is gig workers, and I think that when you look at how layoffs are happening, the continued proliferation of technology that's going to continue to, and not just AI. I mean, a variety of different ways. Just automation, just the ability to do things with less labor. We're only going to trend more and more and more in this direction for a variety of reasons. We're going to continue to sort of grow the rise of the independent entrepreneur, effectively, right?
Yep.
I mean, the independent entrepreneur, right, who is a one or two person, kind of business. Maybe one person and a partner. Maybe they're doing consulting on designing. Maybe they're, doing fashion work. Maybe they run a food truck. So food trucks is a great example. I mean, every Thursday there's a whole lineup of food trucks right in the back of our building here, and everyone loves it. Everyone in the neighborhood, downtown Nashville, goes to this street to get their lunch every single Thursday. It's part of the fabric. But like all those people, they run everything on Stripe or Square, and they're small businesses. I mean,
Yep.
they're small businesses. So what kind of numbers, just to kind of give some shape to where we are today? It's not the future of work, it's the now of work. What kind of
Yeah.
numbers to just kind of help us ground in that reality?
Yeah. I mean, I'll share a couple that kind of, I don't know, come to the front of my mind right now and almost every day is you've got 64 million Americans who are working independently in some way, shape, or form. That is a spectrum, right? There are some people who are very much like high net worth earners who are running themselves as a solopreneur
Mm-hmm.
and setting up their business. You've got folks like my sister, who's a freelance designer, always has been, always will be, right? And you've got a mass of folks who are now working as independent contractors on a growing set of marketplaces or platforms. Like technology has made this easier than
Mm-hmm.
ever to work however you see fit.
Right.
On our platform, we've helped over 4 million Americans now in some form of making benefits decisions, saving on their taxes. And now we've got a new product for them soon. And 70% of them do two or more jobs. So it isn't even just that like more people are working as an entrepreneur or a soloist or as an independent contractor. They're usually doing one or more things.
Yeah.
And a lot of folks we meet are like, they're trying to break away from traditional work. They're doing something as an interstitial layer of work. And then their goal is like, I want to launch a business one day. Right.
Yeah.
And I'm sure
Yeah.
you've been in a hundred different Ubers who have, had drivers who have told you the same story.
All the
And
time.
there's no gradation of like benefits though, right? There's like you're
Right.
on or you're off. So it's real. I'll get to some more stats about
Yeah.
an announcement we're going to make in a moment. But I think everyone kind of knows it, and yet we fail to recognize that it's just the way people work today. The Department of Labor came out with a new rule around employment classification just a few weeks ago, and the number one year they reference in benchmarking all of their recommendations, decisions, and rules is 1947. It's like, how many gig workers were there in 1947? Like, how many people working independently? Nobody, right? You couldn't. And so, like, it's just such like a chasm between the reality of millions, tens of millions of Americans working this way, and it's truly going to be more. The forecasts are 90 million by 2027, which is not that
Wow.
far away.
Wow. So effectively 50% growth in the next 3 years.
Yeah.
Right.
And the other stat I'll share with you, I mean, small businesses continue to grow and to thrive. I see negative headlines, I see positive headlines every day, but small businesses are shapeshifting too. Kaiser Family Foundation recently published some data around benefits for small businesses.
Mm-hmm.
Over the last 2 decades, we've gone from almost two-thirds of small businesses offering benefits, which is still not 100%, down to 50%.
Yeah, sure.
And so like this isn't just like an independent work, gig work thing. It's like independent work, small businesses. Like if you're not working for a mega corp, how are you supposed to get your benefits?
Yeah.
And maybe you shouldn't feel so locked into mega corp, right?
Yeah. Yeah. And look, I mean, I run a small business, and I can tell you two things about that. One, um, when you run a small business and you have a large ownership percentage, you're really not an employee, and so you're not really supposed to do a W-2, um, and so you're kind of out there on your own. And then the second thing is, it has gotten harder and harder and harder to provide respectable benefits to your employees as a small business owner. I think they said that the average cost of health insurance for an employer was going up somewhere between 7 to 8%. But I can tell you for our firm, when we went out and shopped, it was all double digit increases year over year. Um, and then you're shopping that and you're presenting that to your employees, and they're like, seriously, like, and it's a big name plan, right? It's a big name
Right.
plan, but it's not that impressive of a plan, quite frankly. It's just gotten to be so expensive and so difficult for small businesses to effectively provide a benefit that is viewed as a benefit, right?
Right.
As opposed to okay, well, this is what I have to take.
It's either that or your employees have no idea. I mean, our
Yeah,
we're fairly generous on benefits, so our premiums went up 12% this year,
yeah. There you
and
go.
we're fairly young and healthy tech
Yep,
startup.
yep.
We cover 100% of the cost for our employees, so they're not really aware, which is also a healthcare cost issue. But it's growing for small businesses. Premiums are growing at over twice the rate as the average ACA plan, which
Yeah.
a few years ago the ACA was having some massive spikes in premium growth. It's very stable now, and so it kind of begs this existential question of like, are we really better off with a group employer kind of
Right.
benefits construct, or can we continue to grow the individual marketplaces with a greater risk pool, contain more of those costs, and save people money at the end of the day, while also giving them continuity over their lifetime or
and
their professional lifetime?
and by the way, like here's the other thing. Save people money, but like, how about save the business money, which makes the business
Sure.
more stable to be able to pay the people more and to grow the business more effectively, right? I mean, it's
Yeah.
anyway. But let's. I think what we're going to talk about in terms of the announcement that you made last week and the one you're doing this week as well. Um, what stuck out to me when you shared it in the group chat, the when I was reading the press release, were the words portable benefits, right? Because that is always the super sticky part. And quite frankly, like if you've ever for any reason had to let an employee go, right? I mean, you actually care more about their ability to have continuity of their benefits than them finding the next position, right? I mean,
Yeah.
that is like the bigger concern. And so portable benefits is just sounds amazing and also sounds like a unicorn in America. But somehow you're starting to crack the code on that, and that's really why I wanted to talk to you and have you like explain what is this thing that you've kind of figured out, and how does it work, and why is it working in the states where you've sort of found partnerships, and just break this all down to us.
Absolutely. So portal benefits as a concept is kind of simple, right? Just benefits you can take with you. And you're right, whether someone's leaving by, choice or involuntarily, it's a really dramatic impact on their lives if they have to
Yes.
change their health plans, pick new doctors, maybe switch even prescription drugs because they're switching formularies, or pay too much money, in my opinion, to stay on Cobra.
Yeah. Right. Right.
They've got paying Cobra administration costs on top of that. Seems true of retirement, right? Like, why should you have to roll over your 401k to an IRA and deal with all these machinations of shifting your financial foundation when you've just had a massive change in your life, was changing a job, whether you chose to do it or not? It's broken, right? It just doesn't work well for anyone. There's another layer that I'm personally very passionate about, even as we become kind of more like a financial services company and less of a healthcare company, which
Yeah.
is like, I think this has bred a sick care system where if the average American has 12 jobs in their life, they're not staying on any one health plan for very long. And so health plans are taking the role of, let me treat Marcus just de minimis amount and control costs while he's on my
Mm-hmm.
plan, but in 2.5 years, he's going to be on someone else's plan.
Mm-hmm.
Seems a little short-sighted. It is. Um, and I think that's one of the fundamental underpinnings of why we have a sick care system is there's no continuity of coverage. So I have a personal dream tied to overall portability of benefits, which is like, if we keep continuity of care and responsibility, right, where practitioners and carriers are actually managing your risk over your lifetime, boy, like I think we have a much better shot at a well care system.
Mm-hmm.
And this is my pie in the sky idea for you right now is like, What if I could buy my Medicare insurance 20 years in advance? Bet my insurer would treat me differently.
Yes. Yes.
And so, like, I just think the fact that we don't have any portability and that these things are stapled to our jobs, it has ripple effects. Probably has similar ripple effects on, the retirement sector and others as well. There's big ripple effects on our healthcare system. So for me, it's not just the gig economy lacks benefits. No, gig economy is a clean slate, so we can kind
Mm-hmm.
of do more and be more experimental and make faster progress there. But this applies to all types of benefits and work. So 9 years ago, I wrote a little manifesto. I was very dramatic. I was feeling angsty as a founder, and put a dramatic, foggy picture up, and basically advocated for a new system where, regardless of employee classification, W-2, 1099, I don't care, self-employed, that we should have a system where anyone can contribute to your benefits. So Marcus can work for one or more or no companies, and anyone can contribute to his benefits, and he can then allocate what those benefits are and take him with him wherever he goes.
Mm.
The ACA was kind of the first half step towards a portable benefit, because I can go have the same ACA health plan across many different part-time jobs or even small businesses, right? I can keep some continuity there. What's been missing is what I'd call employer contributions. And I kind of like to talk a lot about, I want to shift this to a system from employer control to employer contributions, right? Put money in, but don't tell me which health plans I can have and which retirement option I can choose from, right? Like, let me
Yeah.
keep the ones I like.
Yeah.
And in the 1099 economy, there's a even bigger issue, which is it's not even employer control. There's a bunch of regulatory gray zones that keep 1099 marketplaces, platforms, even just traditional organizations, right? Fortune 100 organizations, from offering some form of benefits or benefits payments to their own workers, because there's risk that it triggers a reclassification.
Right.
And so this has been one of the big friction points, and this has taken me a decade to kind of chip away at. What we need in this country is just more innovative policymaking. We need clarity on why someone's classified in the way that they are. And this is what the Department of Labor came out a few weeks ago and said, like, let's look at 1947. Let's see how we should define this. And the result is, like, at a federal level, we live in a world where there's like 20 different tests to figure out how markets should be classified.
Okay.
And one of them is like, are you offering benefits? I'll be clear. I think there should be a test for classification, right? If I'm controlling your work and when you show up and how you do your work,
That's right.
Great, right? Like,
that's right. I should be on the hook for a lot of stuff.
Totally. Let's use the hows and the whys and the employer risk as a dictator there. But offering benefits, why should that shift someone's employment? And the reality is, like, we're not sure that it does, but maybe it will. And that's created a lot of friction in the space. So one of the things I've been advocating for and waiting for and writing dramatic manifestos in hope of was that we create a system where it's simply not a determinant. You can offer benefits to anyone, 1099, W-2, or, part-time W-2, and not have it trigger anything. Let's remove that barrier and let's let companies innovate. Let's let companies contribute and help their workers. Hasn't happened. In some states, there's been some either ballot initiatives, Proposition 22 in California passed, which created a little bit of a requirement for gig companies, just taxi network, rideshare, and delivery network companies to provide health coverage stipends, some mileage reimbursement, and some occupational accident coverage. Kind of like a half step in the right direction.
Yeah.
And there's legislation in a half dozen other states. Get a little nerdy on the policy stuff, but to set the stage of, like, this is a moment. It's finally happened. And it's probably going to happen in great ways in some states and in mediocre ways in other states.
Yeah, sure, of course.
But we're lacking that clarity. And so the big announcement that we made last week was that in the state of Pennsylvania, we had Governor Shapiro stand up and say, I think in our state, it should be okay for gig economy companies to give money to their workers to allow their workers to pick their own benefits. Like, let's make that okay. And DoorDash came into the state and said, we want to be the first to do this. And so we're going to give a prorated kind of portion of additional earnings to workers and let them put it in Stride Save Account, which is our third product, our kind of third pillar. Healthcare, taxes was next. I kind of skipped over that. And now Save, which allows workers to set up basically goals and withholding to allocate their money into the right set of benefits. So we have, for the first time ever, a governor coming out in support of portable benefits and saying this is okay. And it's a good, new, innovative model. Let's see how it works. Right? Let's
Yep.
not try and perfect it, but let's see how
Yeah.
this works.
Yeah.
We have a major gig company saying we're going to step up to the plate and put money in the pot for our workers to get their own benefits. And then we got to deliver on a long, decade-long dream of mine, which is to build really kind of all the pieces of a paycheck that have been unbundled, healthcare, your taxes, your savings, into a single system where workers are getting their own money, contributions from the companies that they do work for, and from the government, by the way, in the form of tax credits, so they can set aside money for health coverage and make sure they've got it and it's paid for. They can set aside some money to save for PTO or rainy day savings, which, by the way, 63% of Americans can't cover a $500 emergency, and even set aside money for things like retirement, saving for the long term. So we've rebuilt a little mini benefit system,
Mm.
but you needed a big company to step up and say, we're going to do this and we're going to lead from the front. You needed a governor to provide regulatory clarity. And to me, it's just a massive moment, and I hope more people follow. This is not, doesn't have to be just an app-based gig economy thing. They have to be the first movers, a
Sure.
little more bold. But I think it's a super promising step, and we need the federal government to follow their lead too.
It's a massive deal. So just talking a little bit more about how it works. And this I think gets into the Stride product. So if I am a gig worker, or maybe we even take that off of it. I'm a Stride customer. I have an account with Stride Health. Is Stride the thing that enables my portability? Is that the thing that I take with me wherever I go? And it's handling my taxes. It's helping me on a year over year basis make sure I've got the right health insurance plan. And now it's got this savings account that is cleared in certain states with certain companies who have agreed to do it to contribute to my ability to take care of my health, but really to do what I think is necessary in within certain bounds. Is that basically like how it works?
Yeah. Yeah. So we've put all those pieces together in one place. When it comes to healthcare, this is our core kind of product, and
Yeah,
what we launched with was we help you make a personalized decision on picking our health plan. I
sure.
also skipped over this a little, but we have a really interesting integration with healthcare.gov. We partner closely with HHS, and you can actually, Marcus can show up at Stride. I can quickly ping the federal data hub and verify his identity. I can go claim eligibility for and draw in tax credits to pay for coverage in real time and
Mm,
net them out. And so, like, almost 2/3 of the gig workers we got covered last year paid less than $50 a month for a fully qualified health plan.
wow.
That's on Stride, right? Their workforce introduced them to us. So we work with Amazon, Uber, Instacart, DoorDash. We also work with, like, traditional gig economy, as I like to say, Red Lobster, The Gap, Olive
Ah,
Garden. No matter
yeah.
how you work, your workforce can introduce you to Stride, but Stride's yours. Take it with you. They can sprinkle more benefits on top, and some do. So you can pick your health coverage, bring on dental, vision, life, accident, disability, but a full set of benefits there. Those are yours.
Yeah.
We then layer in our app and taxes, where if you're an independent worker, it matters a lot that you know how much you earn
Yeah.
and what you're spending to make that money. I mentioned my spark in Long Island City. A lot of the workers I talked to, a lot of the Uber drivers I met that day, actually, they didn't know how much they were making except for what they made last week and the week before. They
Wow.
had no idea how much they were
Wow.
spending. How much, yeah. And so we built a basic tool
I
that
mean,
helps
but
them
of
track.
course, but of
Yeah,
course, right?
yeah. It's week to week, month to month, and massive fluctuations. And so we built an app that helped them track their income, helped them identify their expenses. We track your miles even. So if you're an Uber driver or a DoorDasher or you're a realtor driving house to house, track your miles will help you deduct them. But it's giving you a home base to make these financial decisions. And then next to that, we launched Save, which allows you to set money aside for those health insurance premiums or set aside money to cover your taxes, right? Kind of build in withholdings for the worker. But then also make these kind of savings-based decisions. So set aside money for the long term or for short term. And so it's that is our product suite. You can all get it in one place, which is really critical for this
Mm-hmm.
workforce. And on top of that, the company you work for, and in this case, yes, as you described it, launching with gig economy companies in
Right.
select states, but any organization, 1099 or W-2, can put money into this account. And then basically have a preset set of quote unquote benefits that you can pick from and allocate that money into. So Marks can say,
That's
great,
so cool. That's the
50
part I
bucks a
wanted to
month
know.
over here. Yeah, 50 bucks a month here for my health insurance premiums. We link that account back to your health insurance and your
Uh,
premiums are paid for every single month, right? Like automating
wow.
it for workers who have plenty of other stuff to worry about.
Yeah. Yeah. Well, I mean, not just, I mean, you're automating it, but you're also keeping them compliant,
Sure. Yeah.
right?
Yeah. Keeping
Because
them compliant.
that money is not there for you to go, um, I don't know, like go to a theme park with, right? I mean, it's there for specific things, right?
That's right. And there's, we've created there is one benefit goal that you can set up, which is PTO. Right. I can't remember if I talked to you about this, but I'm the son of a lawyer, sole practitioner attorney, small town lawyer. Yeah, small town Orlando. It's become a big town. But whenever we went on family vacation, I could always tell my dad was like sort of enjoying himself, sort of a little stressed out, right?
Yeah.
Because he wasn't building any hours. And the
Yeah.
same is true for these workers. So they need what I call synthetic PTO. They need some other option to save up money to replace income, or in some cases, they can use that to cover some of the costs, right? And so you have to think about benefits differently. Like taxes as a benefit, this isn't something we think about in traditional W-2 world.
Right.
And so we've kind of remashinated these different types of benefits into a system that makes sense for individuals. And we have, I will say, a lot more to learn, a lot of benefits we want to add, but the key is simplicity and automation for the individual.
Okay, so I want to go back to Pennsylvania because
Hmm.
things like that don't just happen. And you talked about more innovative policy work, and I know that you're very knowledgeable about the policy, but I mean, most healthcare entrepreneurs, they complain about the policy, but they're not actually necessarily rolling up their sleeves and getting engaged in affecting change at the policy level. I mean, can you talk a little bit about, maybe high level, not necessarily blow by blow, but what what did it take to get to the moment where last week actually occurred? Like as an entrepreneur, I mean, you said it was a decade long dream, but you didn't just dream it. You did some work.
Yeah.
You made some calls, you sent some emails, you got on some planes. Frame that up a little bit for me.
We're supposed to talk about how the sausage is made. I thought no one wanted to hear about that. I'll speak. So some of this, was work that we did, and some of this was great work that our partners did and
Yeah.
the workforces have done. I'll just share a personal story. I was not historically interested in policy necessarily, but when I started Stride, a couple things happened. One, I started going to DC and realizing that, like, first of all, healthcare is a mystery, and people didn't really deeply understand it. But I started this mission of like, can we find ways to partner with the federal government? There's this new website; it doesn't seem to be working very well. Like, how could we help? Some people did not want to help,
Mm-hmm.
but I realized that some did, and I started kind of chipping away at my first policy mission, which was like, can we just get an integration here? Which, looking back at it, sounds a little crazy, but we didn't know what we were doing. And so we just asked, and we got senators to write letters. And I realized, like, oh, you can actually, like, you can rather quickly, if you have a do-gooder story and you're actually trying to move the needle in the right way, you can get people to follow you. And it took a few years, but we got, now we've worked across 3 presidential administrations with very political positions around healthcare to build and nurture and grow a public-private sector integration. I think that gave me a little spark of like, oh, so you can, like, collaborate here. You can find ways to work with policymakers. And so then the next big mission for me was like, we've got to shake this tree of the benefit system. And to be totally honest, Marcus, I'm still figuring it out. I'm still figuring out where, like, labor has certain pushes on certain, policy makers, and where there's state versus federal issues. I still consider myself a newbie, even though I've been chipping away at this for 10
Sure.
years. There's a lot of undercurrents here. But we started at the federal level. And Senator Mark Warner has been a great advocate for portable benefits. He's a big believer. He puts a new bill up every year. It's not passed yet, but he really
Mm-hmm.
has been kind of ringing a federal, I don't know, alarm bell that we need benefits innovation. But it seemed to me that wasn't really going to happen very quickly at the federal level. There's not a lot of movement going on. There is a
Mm-hmm.
hearing this week, hopefully, that will shake the tree a little bit more in the House. I think once we realize, like, this is going to happen at the states level, it just has to start there. We started spending time with legislators, regulators of various sizes and shapes, and the the really interesting thing that I observed there was that nobody really had like tangibility on the problem. So everyone's talking about the polar ends of the issues of here's what's in the headlines about worker issues, and here's what's in the headlines about how companies are behaving, but no one's talking to workers. We're like, oh, well, this seems like an interesting role for us to play. We've got quite a few of them using our app every day, and so we started bringing the workers who are our members. We meet them usually through their workforces to the story, and when you listen to their words, they want flexibility around the way they work, and they also want flexibility around their benefits. So I'm giving you like the broad strokes, but it was a
Yeah.
journey of kind of like figure out what's going to move the needle, because I was hearing from these workers, they want change. I was hearing
Mm-hmm.
from these workforces, we're willing to do more. We simply really can't.
Can't.
And so one kind of big moment I'll never forget is Senator Mark Warner came out. We had a closed door roundtable in San Francisco, and leaders from every single one of these gig companies, not just driving and delivery, but caretaking and home repair, and real leaders kind of across this burgeoning gig economy got together and spoke openly. Everyone agreed. Everyone was advocating for the same thing. It was not a conversation that was happening publicly. And so we kind of took that as our mantle. Like, how do we kind of bring this to light? So kind of fast forward to today, there's bills in half a dozen states. Some are moving in the right direction, some are moving slowly, and some are moving in the wrong direction. And I think I like you're right. Like there probably aren't many CEOs that spend their time on this, but I realize like this is what it's going to take to move the needle here, to kind of shake policymakers and regulators, but they need to hear an authentic story from the workers and from like a company that's sitting at the nexus of these issues. So I give massive kudos to our partners, DoorDash, and kind of bringing along a governor level. We hadn't really done that yet. I will also say I've got another announcement making this week, which is the first legislation signed into law, passed by legislature and signed into law in the state of Utah, passed legislation last year. And this year they're announcing that Stride, we are now expanding the same program we launched in Pennsylvania last week in the state of Utah. The state of Utah did something very innovative here, at least to me, who's a nerd on this stuff. They created it's like a one-liner, like fits on a single page, a bill, which is pretty rare. And it just said, benefits should not be used as a determinant of employment classification in the state of Utah. Go. You want to deliver benefits? Have at it. And no one's done it yet. This was just passed last year. We're doing it. We have our first partner client in the state of Utah. They're launching this month. And you'll see some great, I think, news coming out of the legislature and Governor Cox's office. And so I'm quite hopeful that these are the first two dominoes, if you will, to fall. We need more policymaker innovation. We need people to listen to the end workers and to kind of just create the space for more innovation. I think policymakers are scared of that word, but that's really what we need in this space.
That's a powerful story. And one thing that stuck out to me was, when you said it took a few years, and it's like, a lot of people wouldn't put a month in to something like that, right? So, it also sounds like there was aligned wills really across your industry, and with certain executives. I mean, you talked about Senator Warner, and obviously everyone knows it's not a mystery. Everyone knows that DC is pretty broken right now. But a lot is happening at the state's level as a result of that, right?
Yep.
Because DC is so broken, states are really, making a lot of innovative moves in a lot of different directions, to your point. And Utah is a very innovative state in a lot of ways that people just don't necessarily notice. So it doesn't really surprise me that Utah did that. And it's such a common sense one-liner that you said. I mean, I had never really thought about it, the fact that there are, a series of tests, just like there are in the SEC, the Howey test, right? There's a series of tests to kind of determine, should this person be an employee or are they actually an independent contractor? And it is kind of crazy in 2024 that benefits should be one of the tests that determines that someone's an employee. Because why? Right. I mean, and you can see why in the 40s, in the post-World War II era, why you kind of came up with that conclusion.
It was a test and a requirement, right?
Right.
Like we needed
Yeah,
We needed to attract workers. We need to protect workers. Like there's a lot of uncertainty in the world.
totally.
Great.
I get it. But like today, it just
Yeah.
does not make sense anymore. So
And
I
I,
don't know. To me, this is really, really, really exciting because I don't think people fully appreciate how much the tethering of health insurance to employment locks up our economy. I mean, I think it prevents so much innovation. There are so many people who would be so much more bold in their life choices if it were not for uh, how they rank the importance of having
yep.
strong benefits, and that entirely drives them to stay employed as opposed to going out and try to do something bold and great and important that would make the world a better place. So uh
It's right. And just about a year ago, there was a study done, found a third of American workers would strongly consider switching jobs or going out on their own if it wasn't for that need to stay attached to that benefit system. And
there
so
we
like
go.
you're hopefully this can be a bipartisan issue if there are any of those these days, right? To like unlock the American economy, give people some more freedom when it comes to
Yes,
labor. Yes, let's protect workers. Like, I don't envy the folks who have to write all the rules about how you actually should classify things,
yes,
but let's stop it with all the exceptions and like just create some space for innovation. And there's a if you look at some other forms of financial protection in this country, like 529 accounts, anybody can actually put money into that. Your family members can, grandparents
yeah,
can, right? It's all tax advantage. Like, why don't we do that for benefits and just make it a kind of a much more flexible system that everyone can use. So, and there's one more stat I'll share with you because you asked about stats,
cool.
and I said I'd come
Yes,
back to it.
yes, I love stats.
Utah, over a third of Utahns have actually done some gig work. Over a
Wow,
third of the
wow.
workforce in Utah. And so, I mean, it's just like there's so much gravity there, right? And it doesn't mean everyone's doing it all the time, but it just
No,
really kind of shines a bright light. Like we're kidding ourselves if we think it's just like everyone's going to be tethered to a desk and do normal kind of traditional quote unquote work these days.
no, no. And it's look, I mean, as a parent, it's very, very confusing for me because I would like to encourage my children in the reality of what the market is, but there are still some conventions in our economy that make it still kind of appropriate and wise to recommend that they look into the job force, right? And benefits is a big one.
Sure.
Benefits is a big one, right?
Yep.
Partially because like I'd like them to be off of my benefits, right? So
Well, they're coming up. They're coming up there.
yeah,
Well, my
so
youngest has decided she wants to be a rock star, so she's going to have to figure out her own benefits.
well, may the force be with her, and may
What?
she have all the great fortune of Taylor Swift and Beyonce. Um, no, anything we did not yet cover?
I don't think so. I think we covered it. I appreciate the time. I think this like story needs to be told. There isn't
Yes,
enough innovation in this space. I want more people to come and push on this.
I'm super excited about this for a lot of reasons, but I'll just leave you with this. I'm a venture capitalist, and one of the spaces I am most excited about, personally passionate about, and also really always scared to write a check into is innovation in the employer space. Okay. Because it's so locked up and because there's so many gatekeepers and because the Aons and the Mercers and the, Gallaghers have just such an iron fist over how all things innovation go in this industry. Fortunately, the founders I've invested in the space, do a really good job politicking and networking in those worlds.
You have to.
But they have to. It's not an open market, right? It's a very, very, very closed market, and warm intros are required. And the more that this sort of gets opened up and the more that portable benefits become a thing, even on a state by state basis, that's fine. It creates opportunity for us to invest in great innovative products. Like I think about this stack that you're building at Stride, and I'm like, it's brilliant, and there's so much more that also can be done, right? Going deep across all of those stacks, right? Going deep
Yeah.
into the health stack, deep into the taxes stack, deep into the savings stack. There's so much that could happen across all of those, right? And so, yeah, I hope that this little fire you've started like turns into, four alarm blaze, and we get more and more. Adam Deal, sorry about that. And I hope that we really do get to the place where this is just not an issue, right? That people can
Yeah.
take their benefits with them. I mean, it should
Yeah.
it should be that way, and employers would be happy with that too.
I think so.
Yeah, it's
I
an
talked to
unnecessary burden.
plenty of employers, massive organizations who don't want to be responsible for which doctor their employees get or don't get.
It's
They
ridiculous.
love to help where they can, and obviously some companies are doing a wonderful job of it. Like, is this my job?
Right. Right. It's ridiculous. It's ridiculous.
Yeah.
Okay, man. Look, congratulations on a great 2 weeks. That is really the culmination of 10 plus years of work. And I hope that the rest of your 2024 is really, really fruitful.
Thank you so much, Marcus. It's been fun.